Hello everyone, my name is Lexis Teresi, and my part of the presentation was to talk about the DSM-5 criteria for ADD and ADHD. So what is ADD and ADHD? Oop. ADD and ADHD is known as attention deficit hyperactivity disorder, which is a condition that is mostly diagnosed in children with symptoms such as inattentiveness, impulsivity, and hyperactivity. So although this is primarily diagnosed with children, adults can also be diagnosed with ADD, ADHD. The symptoms always begin in their early childhood, so if they are diagnosed with this disorder later in life, it just means that it may have been missed when they were a child. So the DSM-5 criteria for ADD and ADHD, starting with A persistent pattern of inattention and or a hyperactivity, impulsivity that interferes with functioning or development. So number one, inattention. So having persistent for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social, academic, and occupational activities. So A, often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. So examples here are overlooks or misses details, work isn't accurate. B, often has difficulty sustaining attention in tasks or play activities, so not having a difficult time remaining focused during long lectures in the classroom, being able to hold conversations and being engaged in them, or reading a long book. C, often does not seem to listen when spoken to directly, so your mind seems to be elsewhere, you're not making really good eye contact with the other person, and you look clearly kind of distracted. D, often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. So some will start tasks, lose their focus, and then end up not completing them, or they get sidetracked and it takes them a long time to complete that specific task. Often has difficulty organizing tasks and activities. So keeping organized, making a to-do list and not being able to follow it, and this could be affect someone in the workplace, knowing that you have some timelines to complete, being messy, disorganized, poor time management. F, often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, so not liking being involved with conversations you're not interested in, or a hard time completing those tasks such as schoolwork or things that, for children, maybe they, hate math class and they go through it all day in school and then they have to come home and it's a struggle for them to get their math homework done. Often loses things necessary for tasks or completed, so not having a pencil to do your homework, losing your eyeglasses, and not being able to read the assignment or drive in the car, losing keys and wallets, which I'm sure many of us also do that on a day-to-day basis, because I know I do. But it's a little bit more different when it's constantly happening and you're forgetting things often. H is often easily distracted by outside stimuli, so other things going on that may not be important in that moment or related to what's happening in your current setting. I is often forgetful in daily activities, so forgetting to change the laundry before you go to hang out with your friends, and it's always recurring that you forget to do things before mom lets you go hang out with your friends, and running errands and paying bills. 2, hyperactivity and impulsivity. So A, often fidgets with or taps hands, maybe shakes your leg. Maybe someone needs to constantly have something in their hands, regardless of what they're doing. If it requires you need to sit down or pay attention, that maybe people use things like a fidget spinner or Play-Doh. B, often leaves seat in situations when remaining seating is expected. So I think of, children not being able to sit in their seat in the classroom for a certain amount of time, or if it's long periods of time, having to walk around or roaming in the hallways, constantly needs to be fidgeting in their seat or out and about. C, often runs about or climbs in situations where it is inappropriate. D, often unable to play or engage in activities quietly. E is often on the go, so always having to do something, can't really sit still, you need to keep busy. Often talks excessively. G, often blurts out an answer before a question has been completed, completing other people's sentences, cannot wait for, your turn in the conversation. H, often has difficulty waiting his or her turn, so a child waiting on the lunch line or, lining up to walk in the hallway. I, often interrupts or intrudes on others, so joining in on conversations that you weren't involved with to begin with, or involving yourself in games or activities, and using things without someone else's permission. So then we have B here, several inattentive or hyperactive impulse symptoms were present or prior to age 12 years old. So a lot of these symptoms, again, it's a pattern that you'll notice in the behaviors of the child up into the age of 12 years old, that you're able to recognize that maybe ADD and ADHD is a possible diagnosis for the child because they're experiencing, X, Y, and Z. C, several inattentive or hyperactive impulsive symptoms are present in two or more settings. So again, it needs to be a pattern, and it's not just happening in school, let's say. It's also happening at home or your workplace, when you're hanging out with your friends or family gatherings, school activities. D, there is clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So a lot of these symptoms, are getting in the way of you completing your everyday work, and you're falling behind in your timelines, or in school, maybe your grades are slipping because you're not able to really focus on listening to that lecture. E, the symptoms do not occur exclusively during the course of schizophrenia or another disorder. It's not better explained by another mental disorder such as mood disorder, anxiety disorder, or things like that. Diagnostic features and associated features of ADD and ADHD, just to briefly go over and sum up some of the things we already had mentioned, but diagnostic features, ADD and ADHD, again, usually begins in childhood, but that does not mean that adults cannot be diagnosed with it. Several symptoms need to be present in order to have this diagnosis, and behaviors must be present in more than one setting. So a pattern in seeing it, that it's not only happening in one setting, but it's happening in multiple. Associated features supporting ADD and ADHD, mild delays in language, motor, or social development can co-occur. Low frustration or tolerance, irritability, or mood. And there's a high rate of suicide attempts when combined with mood, conduct, or substance use disorders. Severity of ADD and ADHD, there's 3 listed in the DSM-5. The first one's mild, so just a few symptoms that we just briefly talked about with minor impairments. Then you have moderate, which is in between mild and severe, so you're experiencing a little bit of both. And then severe, many symptoms that cause extreme impairment in different social settings and how you function. So overall, this was the wrap for the DSM-5 criteria for ADD and ADHD. Thank you.